as we continue to progress through what you would think would be normal lifespan as it pertains to trauma, right? Started with pregnancy, and then we went to pediatrics, and now we're going geriatrics. And why do you guys think geriatrics is important in trauma? What? Any guesses? So we're going to see it a lot. They're a special class, so they're going to have some complications, right? Both. No, go ahead.
I would say there's more of them. There's baby boomers and stuff like that.
Yeah, more and more, and plus better living through modern chemistry, I like to call it. People are living a lot longer, right? So we need to know kind of how to take care of them. Okay, so they're at increased risk for trauma or for injury due to not only falls but criminal acts. How many of you guys would associated criminal acts with elderly?
Like them doing the criminal acts?
No. Because they're an easy target. They're vulnerable, they're an easy target. So here's a bit more of information that you may or may not know if you don't follow the news. Here locally, and I say locally, I'm talking like county, region. Last year, we had a rapist who was breaking into elderly women's homes, raping them, sometimes beating them, turning the clocks around, et cetera, et cetera, et cetera. Okay? So they're an easy target. Okay? So please remember that they are, subject to things that most of us would probably not consider. Okay? Head injuries. Wow. Head injuries can be a problem, right? They're more prone to head injury even with minor trauma. Okay? How come? So some of their medications will cause them to, bleed a little bit more. They have more brittle bones. Okay? Calcification of bones. And then increased intracranial pressure. Signs develop slowly. That would probably be from my medication, right? If I'm on a beta blocker, I'm going to keep the heart rate and blood pressure down and that kind of stuff. Okay, and they may have forgotten the injury. Remember, it can be a very minor thing, right? The freezer door was open and I stood up and I banged my head on the door. They might not make that assumption or that association by the time they start having signs and symptoms of that head injury. Okay? So, osteoporosis makes cervical injuries significant, okay? Even with trivial accidents. True story, my grandmother, before she passed away, bent over to put something in a drawer and got severe compression fractures of her spine. Okay? Depends on the level of their osteoporosis. Okay? And then arthritic changes, they have narrowing spinal canals. So what does that mean? Yeah, their spinal canals get smaller, so what is that? Yeah, they can have some neurological deficits based on, right? Because we talked that sometimes it's just about edema, right? Sometimes you can have injury to the bone, but not necessarily to the spine. But if you have less room for the swelling or the edema, you can have compression of the cord. Okay?
Is there more, it's narrow, is there more spinal fluid in there?
I would say no. They don't have the same anything. Like they decrease everything from the amount of saliva that they can create. Literally. So neurogenic shock may be more prevalent. Okay? Probably depends on their injury. They have an increased injury risk, of course, due to these arthritic changes. Sudden movements may cause cord injury even without fracture. That's related to this narrow spinal canal as well. Okay? Decreased pain sensation may mask the pain of a fracture. Okay? A lot of our fall patients who have hip fractures, right? And do you guys know when we talk about hip fractures, do you guys know what's actually usually fractured? Because you can't, no, actually it's not the pelvis. Because you can't fracture a joint, which is really a hip. Okay? What did you say, Will? The femoral head. So, yeah, my femur kind of looks like this. and it sets in here, and it usually breaks at the head or the neck of the femur, which would be here or up in here. Okay? Usually they're talking mid-shaft femur. But when they say hip fracture, it's actually, yes, a femur. It's either usually a femoral head or neck.
Do you lose just so much blood?
Yes. They have potential. Okay? Anyway, so we kind of got off on a tangent there, right? Okay? So decreased pain, and what you'll find is, if I was to break my femur, even if it was my femoral head or neck, I don't have that decreased pain sensation. It is going to hurt. Okay? It's not going to hurt like a mid-shaft femur where I've got that. Remember what happens? I got constriction and it causes muscle spasms. So I may not get that as much. They a lot of times don't complain of pain unless we move them. They'll go, as long as I'm just laying here, maybe a 1 out of 10. Move me, it'll go up to 5 or 6. Right? Where most of us, if we have a fracture or crack in our bone, we're like, oh my goodness, this is killing me.
Why?
Neurogenic differences. So like everything, they lose like the weight of their brain decreases by like 15%. Their neurons decrease. Their capacity to carry the nerve impulses decreases. Everything.
So is that kind of like a baby where they don't understand the concept of pain?
No, babies still feel pain. This actually decreases. It doesn't travel the same, right? So they have decreased sensation actually. Okay? Oh, goodness. Okay. So the respiratory system. Aging decreases chest movement and ventilation capacity. We kind of talked about that already. Okay. Respiratory reserve decreases. Okay. And then organs have less tolerance of anoxia. So what's anoxia? Well, okay, something with oxygen. What does A mean? It is the first letter of the alphabet. Right. Lack of. Okay.
Isn't that the same thing as that?
So their organs need more oxygen?
They have, well, they don't tolerate it when they're without it as well. So they're going to probably start showing, they will progress more rapidly from compensated to decompensated shock because of things like this. Okay?
You describe this like time without oxygen,
Yeah.
not just for oxygen.
Right. They just don't tolerate it as well. Okay? Their organs don't tolerate it as well.
Is that include acidosis?
Would that include acidosis? Everything. They don't tolerate anything outside that normal as well. Is that what you're asking me, Will? I'm not sure. Yeah, they just don't. No, it's going to skip like 4. Hang on a minute. I may have to do this one over here. Okay. So, COPD may be present. Positive pressure may cause a pneumothorax. Right? What does positive pressure mean? Say it louder. If we're ventilating them. So if we're creating that positive pressure, okay, we can actually cause barotrauma. They're COPD people, remember we talked a little bit about this when we talked about CPAP, because they're very frail and they don't have the elasticity. So it's easy for us to pop a lung. Remember when we started talking about like CPAP, okay? Hypoperfusion can cause severe tissue hypoxia, okay? They don't tolerate it as well. They're going to react a little more aggressively, right? Because then they become more acidotic and whatnot. Decreased cardiovascular reserves, so they move to
With COPD and elderly, you wouldn't use positive pressure.
yeah. If you use positive pressure, you have to use lower settings. Remember we talked about, for example, CPAP.
Yeah, that's.
So remember you can set some CPAPs 5 of PEEP, 10 of PEEP, 7.5 of PEEP.
So you want to just jump to a beat.
Yes. What you have to be careful is and most of your BVMs are going to have a PEEP regulator on it. Okay, remember that positive index expiratory pressure. You need to set it at the lowest setting because they don't tolerate the expansion as well. Okay, because of their disease process. Does that make sense?
We have a peak measure on the BVM ball.
Some of your BVMs will actually have PEEP, yes. And it depends on kind of who you get it from and what company made it and that kind of stuff. Okay? So we already kind of talked about this, right? They're going to move into decompensated and irreversible shock very rapidly, much more so than we are. And then they're going to tolerate hypoperfusion poorly. Okay? Even for short periods of time, these guys can get into kidney failure due to something like dehydration, right? Hypovolemia, like dehydration. They'll go into kidney failure a lot sooner than most of us would. So they just kind of progress generally. Okay? Hypoperfusion can occur at normal tensive pressures, and that leads to things like CVA, MI, bowel obstruction. You'll see a lot of adults or elderly with bowel obstructions or infarcts. Renal failure, which is kind of that kidney function we were talking about a second ago. And then adult respiratory distress syndrome. Okay? Cardiac blood pressure medications like beta blockers. We've talked significantly about how they can mask the signs and symptoms of shock, right? What do we know about somebody who, say I'm an elderly person and I'm on esmolol, okay? Remember the OL, the end of those medications, okay? What happens when my heart rate is like over the 90? What does that mean?
Way high for
Yeah. It's way high because what does a beta blocker do? It regulates, keeps my heart rate low, and it keeps my blood pressure low. Okay? So I can't compensate. I can't do those things. Okay? And we talked a little bit about this. This is they kind of look like kyphosis a little bit here. Positioning and packaging need to be modified to accommodate. Okay? And these guys hurt. Is it okay for you to put some padding down where their spine is going to lay right on that hard spine board? Absolutely. Absolutely. It doesn't take much for them to get skin breakdown, decubituses, decubiti. Okay? It doesn't take much for that to happen. Okay? So ask about pre-existing conditions when splinting and packing. Environmental emergencies. They tolerate temperature extremes poorly, right? And we'll learn a lot about that when we start talking about our heat injuries and that kind of stuff. And then they develop hypo and hyperthermia rapidly. Okay, so they don't tolerate it and they progress through it a little bit quicker. Okay, because they lose, along with losing the ability to produce saliva, they lose some other abilities, like they don't sweat as much. Right? That would tell me why they progress and they become hyperthermic quicker. Right? Because what do we do to cool ourselves off? Sweat. Okay? Yeah, absolutely, because now they have that decrease in sensations. Okay? So these guys are at high risk for a lot of different stuff just based on normal aging process, okay? Any questions? No? None at all? Did you know all that stuff happens as you get older?
all of your life.